Custodial Training Series, Level 1, Personal Protective Equipment, PPE, Safety First. In this training, you will learn why safety is a 24/7 attitude and the purpose of personal protective equipment, or PPE. You will learn about available PPE, how to select, remove, and dispose of the equipment safely.
According to the National Safety Council, 80% of all accidents are the result of unsafe acts, not unsafe conditions. That is why training is a key part of any effective safety or maintenance program.
Safety is a 24/7 attitude, 24 hours a day, 7 days a week. It cannot be put on or taken off like a piece of clothing while you are at work. Safety becomes part of who we are and is a way of looking at the world.
What seemed like a good idea at the time can turn into serious accidents. Accidents are typically lapses in judgment.
OSHA, the Occupational Safety and Health Administration, recommends that your employer use controls to eliminate hazards entirely. For example, building a barrier between the hazard and employees is an engineering control. Changing the way employees perform their work is a work practice control. If these controls do not provide enough protection, then personal protective equipment is the last level of control.
Personal protective equipment is designed to protect your body from workplace hazards. It consists of clothing or equipment worn on your body. Different jobs may have different requirements for protection.
The most common hazards are biological, biohazardous materials, blood, body fluids, and other potentially infectious material, human or animal, may contact your skin, eyes, mucous membranes, and even your street clothes, exposing you to blood-borne pathogens.
Blood-borne pathogens are a real threat to your health. For example, HIV, which leads to AIDS, has no cure. Hepatitis B has a vaccine and may be cured, but may also have long-term effects. Hepatitis C has no cure, and treatment is only about 40% effective.
Other health hazards may be chemicals and overexposure to harmful dusts. There are also physical hazards like moving objects, electrical connections, and sharp edges.
PPE works as a layer of protection. Your unbroken skin is the first layer, since any break or opening in the skin is a potential route of infection.
Examination gloves are a second layer of protection. Rubber gloves may be a third layer. The more layers of protection between you and a hazard, the better protected you will be.
PPE is a barrier against injury. You may not be able to prevent all accidents, but PPE increases your chance of staying safe when an accident happens.
Employers are required to determine if personal protective equipment should be used to protect their workers and to provide, maintain, and replace PPE at no cost to employees.
Speak with your supervisor if a label or material safety data sheet recommends PPE that is not available in your workplace.
As an employee, you need to demonstrate understanding of PPE training, when it is necessary, what PPE is needed, its limitations, how to properly put it on, adjust, use, and remove it. You need to know the proper care, maintenance, and disposal procedures for each type of PPE you use.
The criteria for using PPE is the test of reasonable anticipation. If it is reasonably anticipated that blood could contact your hands, then you are required to wear examination gloves. If it is reasonably anticipated that something could fall on your head, then you are required to wear a hard hat.
Not all facilities have written procedures for every task that needs PPE. If you reasonably anticipate a risk, use appropriate personal protective equipment to protect yourself.
Let's learn about some of the types of personal protective equipment available. There are many other types of PPE that may apply to your workplace. Before using any PPE, remember to inspect it to check for damage or contamination.
Hard hats are required whenever there is a hazard of falling objects, like construction sites. If you see people with hard hats around, you should probably be wearing one too.
A safety harness is used to stop a fall when you are at a height or working over dangerous equipment.
Single-use disposable gloves, known as examination gloves, are the most common type of PPE for biological hazards. Gloves must be provided that fit your hand and are available as latex, vinyl, nitrile, with powdered and powder-free options. You should always discard examination gloves after one use because they lose their effectiveness over time. The longer they are used, the more likely they are to break.
Utility gloves are made stronger than examination gloves and can be reused as long as they are not compromised with holes or tears. Utility gloves are available in rubber, heavy vinyl, plastic, nitrile, and other synthetic blends. Be sure to decontaminate utility gloves that are exposed to hazardous material.
Remove gloves with the awareness that the outside of the gloves is contaminated. Grasp the outside of the glove with the opposite gloved hand and peel off. Hold the removed glove in the gloved hand. Slide 2 fingers of the ungloved hand under the wrist of the remaining glove. Do not touch the outside of the second glove with your skin. Peel the glove off over the first glove. Discard gloves in a waste container. Always wash your hands with soap and running water for 15 seconds after removing.
Other types of gloves protect you from physical hazards. Metal mesh or Kevlar gloves are a barrier against sharp objects, and insulated gloves stop electrical energy.
Safety glasses protect your eyes from flying objects. Safety glasses are not meant for splash protection like goggles are.
Welding helmets protect from harmful light and flying debris.
Goggles prevent liquids from contacting your eyes and have a different purpose than safety glasses. Protect yourself from chemicals splashing or dripping on you when working overhead. Rinse before using, decontaminate after each use, and store in a dust-free environment.
A face shield blocks liquids from your face. Rinse reusable face shields before wearing, decontaminate after each use, and store in a dust-free environment.
A single-use face shield is a transparent sheet of plastic attached to a surgical mask. Dispose of this type after each use.
When removing goggles or a face shield, remember the outside surface is contaminated. Grasp the portion of the safety goggles or face shield nearest your ears and pull up and away from your face. Handle by the headband or earpieces only. Decontaminate or place in designated receptacle for reprocessing or in a waste container.
Face protection is sometimes ignored because it can be uncomfortable to wear. Ask yourself, what is more uncomfortable, wearing goggles or getting acid in your eye?
Single-use shoe covers prevent the incidental contact of biohazardous materials with your street shoes, but are not designed for a flooded area. They must fit correctly. Dispose of single-use shoe covers after each use.
Rubber boots are a barrier between your street shoes and large amounts of liquid, like a flooded restroom. Stripping boots are not technically personal protective equipment, but they do protect your shoes from chemicals and provide grip on slippery floors. Clean and decontaminate boots after each use.
Footwear may also have steel toe protection for falling objects, or a reinforced sole to block puncture. Some boots insulate from electrical energy.
Liquid-proof aprons prevent the contact of small splashes of liquid and are made of plastic, vinyl, or rubber. Decontaminate after each use.
Single-use aprons are typically made of light plastic and are discarded after each use.
Gowns are a fabric barrier between you and the workplace. Gowns are often used in healthcare facilities for cleaning operating rooms, isolation rooms, and other contaminated areas.
When removing gowns, remember that the front and sleeves are contaminated. Unfasten all ties and pull away from neck and shoulders, touching the inside of the gown only. Turn the material inside out, fold or roll into a bundle and discard according to your workplace procedure.
Dust masks stop the inhalation of dust-sized particles, but don't stop airborne germs.
Respirators only protect you if they fit or seal to your face, so you must be fit tested by qualified persons before using, and continue to have annual fit testing, or whenever the shape of your face changes. Your employer must have a written respiratory protection program in place.
N95 respirator means it is NIOSH approved to filter 95% of airborne particles, including pathogens. The mask may have a one-way exhale valve.
When removing respirators, remember that the front of the mask is contaminated. Don't touch it. Grasp the bottom, then top ties or elastic bands and remove. Place in designated receptacle for reprocessing or a waste container if the mask is disposable.
Half-face respirators only filter the air. Full-face respirators also protect your face and eyes. Both types may use cartridges that can be changed to protect from different risks.
Self-contained breathing apparatus, or SCBA, is used in extremely toxic environments. SCBA contains its own air supply and does not filter outside air.
Specialty suits include chemical splash suits and hazmat suits. Hazmat suits, overall protection from hazardous materials, may also require a respirator or breathing apparatus. These suits require special training before you can use them.
Reusable PPE should be decontaminated after each use. Clean surfaces with disinfectant cleaner, rinse, and let it air dry.
PPE made with rubber, plastic, and vinyl should be stored without crushing. This will reduce cracks and damage.
Single-use PPE should be discarded after one use. Put in the trash or a hazardous waste container depending on your employer's procedures for that type of PPE.
Safety is a 24/7 attitude that you wear all the time. Personal protective equipment is a barrier against hazards in the workplace.
PPE is available for health and physical hazards. Choose PPE based on reasonable anticipation. Safe removal and disposal of PPE contains the hazard.
PPE is personal. Protect yourself.